This is the Critical Minds Show, and I am Telani Fashion, your media queen from the Savage Line. It is another beautiful opportunity for us to, discuss major matters, trending matters, and issues that the public, is very much concerned about at this time. We are going on the medical train. We're having a guest who's going to explain some issues that bothers around the human life, the human body, and then, pathology matters, especially as regards what the society is experiencing and a question that the society would keep asking. So we'll go on a short break and we'll be back. You stay with me.
Good afternoon, Dr. Brian. It is a utmost pleasure to have you on our talk show, The Critical Minds. Sir, we want to know about, we know you're a pathologist, although we may not know everything about pathology. The only brief that the larger public know is when you mention pathology, it seems like they handle dead people. That is most of what we know. But we want you to tell us more what we don't know as coincides as we can about pathology and basically about the autopsy, that autopsy topic.
Okay, first of all, the public, they are not wrong in thinking about that we handle dead bodies. Yes, it's an aspect of our work because we are the ones that manage the mortuary. So that is why in my bio, I talked about providing death care services, which involves managing the mortuary. When someone is dead, usually if the person is not going to be buried immediately, the person will be taken to the mortuary or morgue. Then there is either the person's body is preserved for a short while, either with the freezer, or we carry out an embalmment. And then if there's some disfigurement, maybe from a road traffic accident, apply some cosmetic remedies so that the person can be presentable for burial until such a time when it's time for the person's burial, then the person is now buried. So we provide that death care services. But however, on the broader scale, the service we provide, apart from teaching, doing teaching and research, is that we provide diagnostic services in the hospital. When surgeries are carried out, the tissues that are removed, the specimens that are removed from the body, whether in terms of fluid or tissue specimen, we process them in the lab and then we make a diagnosis, whether it's a cancer, it's not a cancer. So that in a nutshell is the services we provide. Then in terms of autopsy, now if you look at the word autopsy, you see that it starts with the word auto, which is like automatic or self. And then if you can relate with the other word opsy, or like optometry, optics. Okay. So it's like seeing for oneself. The other name for it is post-mortem examination. What it actually means is we are trying to learn from a dead body what's led to the death of that dead body. So it's as if the dead is teaching the living. So if I now want to give you the technical definition, autopsy, otherwise called postmortem examination, is a surgical procedure performed on a dead body in order to determine the cause of the death and also to be able to put together the events that led to death. So that's what autopsy is. I don't know if I can go ahead to classify them, tell you.
Yes, we want to. Okay. So much.
Okay, so now there are different types of autopsy. They include, number one, what we call medical legal autopsy.
Medical legal.
This is the Yes, this is the type of autopsy that require going to court to finalize what is the manner of death and what actually, so that someone can be actually convicted as having a hand in that person's death. So any type of autopsy that is also called coroner's autopsy, that there's suspicion of foul play, falls under
Sorry, you
foul play.
mentioned the word. No, you said also called something autopsy.
Okay, coroner's autopsy.
Coroner, okay. Coroner.
Coroner's autopsy. Okay, it's all types of autopsy where there is a suspicion of foul play, that the death resulted as a result of unnatural causes. So they involve deaths from road traffic accidents, deaths within 24 hours of admission in the hospital, deaths at the surgical operating table, deaths within paramilitary or even military camps like prison, or maybe in NYSC, all those kind of places, death from drowning, death from hanging, death from electrocution, and even death from suspected poisoning, death from rape, or any other type of violence. Once is unnatural, what we refer to as natural death is one dying from a known disease and one dying from old age. Those two qualify for natural causes of death. Okay. But any other thing outside of this qualifies as unnatural causes of death, and they will now fall into the bracket of qualifying for indication for coroner or medical legal autopsy. The truth is that our legal framework is weak. That's the truth. Now, you remember at the beginning, I told you there are two types of autopsy. Yes. The medical legal or coroner or forensic autopsy. That's number one. Then number two is the hospital-based or clinical autopsy. Now, the major distinction between the two is that forensic autopsy does not need consent from the family members of the deceased. It's fully under the legal framework of the government to determine what caused the death of this individual within this jurisdiction. Whereas for hospital autopsy to be done, you need to fully explain to the deceased relatives what happened and why autopsy would be important. And then they are now given an informed consent form to read through it and then sign before the autopsy can go ahead. But because our legal framework in Nigeria is not firm enough as it pertains to carrying out death investigation, a lot of people, they will have a relative that dies, and that death qualifies for forensic investigation, falls under the indication, meets the criteria or the indication for coroner autopsy. They will still be arguing, don't touch the person or don't touch the person. And nobody touches, goes near. But in civilized climes where the legal framework is already there, if a citizen dies in this manner, that there is unnatural causes of death, then everybody have to stay back and allow the agencies involved to investigate his death. So in such cases, so if those laws are being well applied in our country, then once there is an unnatural cause of death, relatives have no say until after the autopsy, then they are given warrants to bury. That's when they go and bury. But I hope in future things will change.
It's like a test that's being carried on the dead body just to know what is the cause, of the deaths of the person involved. If such thing happened to someone I know and we are not too sure of the death of the person and we need to carry it out, if need be, for us to understand what had transpired, why not? As far as the truth will be out, it depends on the position of the death of the person involved.
Autopsy is a test conducted on a dead person to ascertain the cause of the death.
Would you permit an autopsy to be done on any of your loved ones?
Yes, if situation warrants it.